Are you a healthcare professional looking for a trusted concussion resource? Then you've come to the right place. From her New York City studios, welcome to Concussion Corner with your host, Dr. Jessica Schwartz.
Welcome to the Concussion Corner Podcast. My name is Dr. Jessica Schwartz, and I'm thrilled to have Dr. Lily Jimenez with us today. Dr. Jimenez is a neurologic physical therapist, online neuropreneur, and a host of Neuro PT Made Easy podcast. Dr. Jimenez is dedicated to guiding clinicians toward both neuromastery and purpose-driven branding, helping them step confidently into their calling as experts and leaders. In this episode, we dive into concussion myths and misconceptions, why we no longer grade concussions, the role of the cervical spine in recovery, and how building a personal brand can strengthen patient trust and advocacy. You will leave this conversation with both clinical clarity and practical tools for showing up authentically in your practice. Welcome to Concussion Corner. Welcome to the Concussion Corner Podcast.
Hi, thank you for having me. I'm so excited.
I am so stoked. And I want to say to have you back because for the listeners, we are actually doing a crossover podcast with the Brain PT, which is Lily Jimenez podcast. So this is kind of, I want to say part 2, but we'll make sure to have all of our links in the show notes. So I would say welcome back, but welcome to Concussion Corner.
Thank you. Thank you. I'm so happy to be here.
I am so stoked to have you on. And, we met at APTA CSM in Boston in 2024. And boy, I was like going through it, but I was like, you know what? I've got to get there. I can drive from New York. I was like, let's go. And I'm so grateful because I met you, I met Julie Hirschberg, I met so many great people in person that I've been like online with for years. So it was just so lovely to connect in person.
Yes, it was.
And here we are. So we've been cheering each other on online, supporting each other for years at this point. And you've been doing such good work in the physio space and really kind of newly talking about this new word that you've put together called neuropreneur. So I would love to have people know first, you are a board certified neurological clinical specialist. And what does that mean in the physical therapy realm? Because we have people in over 60 countries listening to this. And I think it's important for women, Latinas in medicine. We just had Dr. Monica Gutierrez on, who's a physician down in Texas. And she was a point of the federal board for long COVID before they nixed that here in the government. But what does that mean for physical therapists and women in physical therapy? And why is that so important that you got that certification?
Yeah, so a board certified specialist in neurologic physical therapy is just someone who, the best way that I can describe it in my own words is someone who is just committed, who is devoted to treating people with neurologic conditions, and they want to take their career into just a specialized, highly specialized place. You're living and breathing neurology, loving treating people with neurologic conditions. And so we call it the NCS specialty. It's a neurologic clinical specialist, and you treat patients for certain hours, or you go through a process of a residency, and then you take the board exam, which is a very hard exam, and then you become specialized, and now you have, of course, that certification that tells others, okay, Lily, she is a specialist in neuro. And if I have something related to anything neuro, I'm going to go to Lily, right? So that's what stands out. And what's so important is you can still be an amazing physical therapist and not have NCS, right? And they are amazing therapists out there. NCS, the certification, just mainly it's a commitment, right? It's a commitment to those people. It's a commitment that I'm going to advocate for you. I'm going to devote every single part of me and my brain in learning about that specific diagnosis and keep myself informed, keep myself updated, bring you the best care out there, and just kind of grow with the profession within neuro. So I think that's a little bit about what it means to me, and a little bit to share with your listeners.
I think it's important too, because we tend to have alphabet soup after our names with physical therapy. And yes, I think that some of the lettering can get watered down. But again, that is coming through the American Physical Therapy Association through our board certification process. So it's just lovely to see. And that's part of why you're here. So we know you have a love for neuro. Obviously, this is Concussion Corner. So we're neuro and ortho and all of the above. But I want to talk to you because for our listeners, Lily is on the podcast with us because she really is doing phenomenal work with her programming that she's teaching clinicians all over the world about, and the word is neuropreneur. And we're going to talk a lot about branding and what that means. And that's important to me here. We are not funded by anything federally here at Concussion Corner or through the podcast or the Academy. However, in mid 2025, it was unbelievable because I was in Milwaukee for the first time at the Concussion and Sport Group midterm meeting. And literally that day, the Centers for Disease Control and Prevention Traumatic Brain Injury program was actually completely eliminated. The 4 or 5 people that ran that program were completely eliminated from their office. And we were all in the room where it happened. So we were literally talking internationally, midterm group break about Concussion and Sport Group. And literally everyone's funding was gone. And so we had people incredibly stressed out, not because their livelihood was affected as well, but because all of the work that we've been doing for decades and decades and decades was completely halted. And I think at the end of the day, we want to make sure that we're connecting to storytelling and the why of what we're doing things and the why we're serving the people the way we're serving. And for here at Concussion Corner, our mantra is teach one, serve many. And again, we want to connect to how do we talk about the work that we're doing so we can maybe think outside of the box, so we can both from a therapeutic aligned standpoint have patients trust us, but then also seek funding and seek storytelling for educating other healthcare professionals and really getting those stories out. And I think you're just doing such a lovely job. So I'd love for you to highlight what you're doing over on your side of things and why that's been so important to you and how this came up as an idea.
Yeah. So I mainly serve 2 groups of lovely people. One is I help with some resources for people who are preparing for that big exam that we talked about some minutes ago. But the other part that it just came like an accident was that I started to find a passion into learning about personal branding and online businesses. And it was such a weird shift for me because I'm a therapist. I talk to me about strength and range of motion and all that. But then I strangely became very interested in the online marketing terms and, personal branding and all of that. And it was so strange for me. And I remember that I was kind of like planning what's going to happen during the summer for me in terms of my business, my online business. And I truly, I know this was God for me because out of nowhere, I had the idea like, what if I teach others how to build their personal brands? And so one thing that we need to understand is that humans connect with humans, not with businesses. And so if we want to build a business, the best first move is to build your personal brand. And so just this morning, I was listening to a podcast, and there's this huge person right now in the digital world. His name's Alex Hormozy. And if you don't know Alex, he is an entrepreneur, he is an investor, he is a content creator, he is an author, an educator. And he made $100 million in 2 days. And so it was not because of the product that he was selling, which was, a book, his new book, but it was because he had a personal brand. If he would have set up a sales page with 2 sentences, people would have bought regardless of the product because they connected with him, because he had brought so much value to his people. So personal branding is about that. So that's what everything came about. Like, oh, Lily, let's put that idea in your mind. And so I teach others in neuro, within my neuro world. I always say, if you want to teach everyone is a lot of people. So you got to find who's your people. And so I teach people who love neurologic rehabilitation how to build their personal brands online. That way they can shine and bring their brilliance out of the clinic and reach so many people out there at a global level. And so that's one thing that I'm starting to do. And then you can connect your personal brand with an online business. What I do right now is I teach you how to launch your online education business with a starter course, like a workshop or a masterclass, webinar, however you want to call it. And so I do that because that's a process that I've taken myself with the Brain PT. I've built my personal brand for about 5 years. And then I decided to launch my education business. So that's a little bit about what I teach. It's like all from experience. It's all from my own experience.
No, that's fantastic. And even just thinking about your connection with Alex Hormozy and things like that, it also reminds me of like the Simon Sinek Start With Why. And I know it's been 10 years since he's doing that. He's putting a new book out. But again, it's, the why, not the what or the how. And that's why people are connected to. And I know for me with the academy side of things, I've been so bogged down in building that I've been disconnected from the why, because we're like, okay, we just got to get it done. We just got to get it done. Every 24 weeks of programming, every week has cost 40 plus hours of sweat equity to build, times 24. So we're just in the what and the how. And now we have to connect to the why. And
Right.
I think it's important too, for the people that are listening to, that are either have been a part of the CDC, are federally funded by the government. How can you get your personal brand and story out to talk about the research that you're doing? And I think it would be so incredible for them to connect with you, because again, we have to think 360. You can't just do one thing in the world. And that's why so many healthcare professionals, moonlight or have multiple jobs like we all do, and all of the above. So I just think it would be so incredible for them to connect to what personal branding is, because it's not something that's learned in school. It's not something that's learned in a PhD or a postdoctoral program. It's like, okay, how do you get the why to what you're doing 40 hours a week in a lab with no one looking? How do we get that information out? So I think that would be so neat to kind of connect to, if you have any ideas for folks before they come to you, to link up.
Yeah. So I always think that we all have some time in our life, a little nudge that we're meant to do something more. And like we have that little whisper that it's like that passion whisper. And so that eventually becomes our why. So like my why back then when I was building the Brain PTs, just reach out many people and just share the love for neuro, just literally just share and help as many people as I could with their NCS prep. And now, of course, the why starts evolving, right? Like it's evolved. Now I have my family. And so my why now it's like connected clinicians, but also my family. Like I want my daughter to see what I'm doing and how I'm serving people, etc. So the why is so important. And the why also involves who you're serving. So if you don't have clear who you want to serve or who you want to reach, then that personal brand will suffer a little bit. And I'll kind of dive deep into that. But people, when you're building your personal brand, people think it's only for the experts or for people with a lot of experience, or it's just for the influencers, or it's just for the big people or big businesses only. And people think it's just very time consuming. It's not for me. I'm just like Lily and in El Paso, and like that personal brand is not for me. Like people might think that. But personal branding, it's really how you are perceived by other people. It's the art of presenting yourself in a way that authentically reflects who you are, what you stand for, and the unique value that you bring to the table. And so, how do you start that? Of course, there is a part of putting yourself out there, and that is a fear of visibility that a lot of people go through. And so, what is the best next step? People think that to put yourself out there, you need to be perfect. But the best place to start is taking massive imperfect action, because you learn through the process of putting yourself out there. You start connecting with people, you start building relationships, you start reaching people that you never thought you could reach. And it needs to start somewhere. And it's not being perfect. You need to start with massive imperfect action. Now, how does that look like? Introducing yourself, what you're passionate for online, what you stand up for. You mentioned the traumatic brain injury, the group of people, right? And the people who want to present research and all that. But people need to know who you are so they can identify that research with you. And so the best way that I tell my students is the best way to start your personal brand, it's to introduce yourself to people online. Hi, my name is Lily. This is who I am. These are some things about me. This is what I believe in. And that's how you get started. And then you just start pulling out of your why. If you believe this is what's supposed to be done, if you love, in my case, if I love topics in neuro, I just start posting about it. I start sharing about it. I start sharing my views, my opinions, connecting. One of the top things in my brand is connection. To me is everything. And so if people see you connecting with them, engaging with you, talking to you like a human, your brand is already being perceived a certain way. And so I feel it just starts by putting yourself out there and not being afraid of being imperfect, because we in reality, we don't like when people show up online, they're like perfectly, like it's all produced and they look all pretty and all that. I had to let myself go from that, because at the beginning I was like makeup on and all that and look in my And then I was like, people just want to see who Lily is at home with the crazy hair and speaking Spanish, forgetting how to put the forgetting to put the mug on the Nespresso machine and making a mess. And so that's what people like. And then you build that who is that person with what you believe, what you appreciate, what you support, what you do, what research do you do. So that's a little bit about the personal branding process.
That's fantastic. I'm gonna take you up on the challenge. I'm gonna introduce myself because for me, I was doing that on Twitter 10 years ago, and Twitter is now called X. I'll still call it Twitter. But I've realized that people don't know me, who I am now, and they don't even know I'm a brain injury survivor that lives with persistent symptoms. So I think that's important, at least for my story, to reintroduce myself. And for me, I think what did you say? It was so perfect. It was the massive imperfection and or what was it?
Massive imperfect action. Yes, it's the key.
Massive imperfect action. Yeah, and good enough, and we say this all the time, is like good enough is better than most people's excellent. So because we're actually getting it out there. And do you watch Diary of a CEO?
No. Well, I started listening. So good. Yeah.
Yeah. So same thing. I'll have to find the quote and I'll put it in there for the listeners. But he said the same thing, is that it has to be messy. Just do it. And it's like very Nike, esque, and it's just do it from a branding perspective.
Yeah.
And I think that's so important to connect to, especially because I think there's so much like nefariousness that also kind of feels with social media. That's why a lot of people have gotten off social media, but there's also so much good because it's a free open access medical education. I'm part of the FOAM movement, FOAM, free open access medical education, started by the emergency medicine docs. If we can get good information out there to people, and again, it's about connecting to the know, like, and trust. And I think it's about everything, whether you're going to a restaurant here in New York City. And we haven't spoken about this behind the scenes, but we'll talk about it now, is that I've been saying for years, when I graduated in 2010 with my doctorate before residency, I went with my aunt at the time, she passed away in 2021, but this was a super, I used to call her Gaga. Her name was Gail. And so Lady Gaga was my graduation gift. And so this is coming around full circle, I promise. But I think Lady Gaga is a master of personal branding, because if she were to walk down the street in New York City, I would walk right past her, because she allows us to see what people want to see and know about her. And I think that's important from a professional perspective as well. So you can share with your family, or you don't have to share about your family, or you can share about your research, or you don't have to share. But if you're wanting to get information out and you're spending all of this time working on creating good for the world and for people who we serve and why we're here to serve patients, why not talk about it? So I think it's so important to connect to that. The personal brand, it shouldn't feel like selling. It should just be a part of your life and sharing what you're comfortable with. But then again, there's a lot of fumbling around. So it's so great that you have a program and you have coaching to kind of get people there, so they skip the frustration, because so many people start and then stop. So what are some things that you see that are common barriers? And it really is like teaching, right? So you're coaching people with the NCS, coaching prep and just mindset shifts. And then you're also coaching people about personal branding with the Neuropreneur. What are you finding are some common themes that people are either getting frustrated with, or they don't believe in themselves, or why do I have to do this? What are you finding? And now, a word from our sponsor. Did you know that sport helmets are rated on a 5-star system similar to cars? And the safest helmets have nothing to do with price, brand, or availability? Since 2011, Virginia Tech researchers have been providing unbiased helmet ratings that allow consumers to make informed decisions when purchasing helmets. The helmet ratings are the culmination of over a decade of research identifying which helmets best reduce concussion risk. This work is done as part of Virginia Tech's service mission and is 100% independent of any funding or influence from helmet manufacturers. Our mission at Concussion Corner is to expose you, the listener, to trusted spaces in the concussion arena that translate to clinic next day. Please visit the Virginia Tech Helmet Lab website in our show notes or at bit.ly/Virginia Tech Helmets and spread the word to aid in lowering concussion risk in your community. Thank you for tuning in, and let's begin the show.
One of the biggest things that I find people have trouble, or my students have trouble, it's that fear visibility, or visibility fear. I'm too afraid of putting myself out there. What are they going to think? What are my colleagues are going to think? And so that comes with putting yourself out there. But the moment you put yourself out there, I always say something magical happens because it's like you're putting your step down and you're like, I'm here and I have arrived, right? And it opens up so many doors. For me, the Brain PT, it was a project, a little project, right? It was just in the middle of COVID. Also, it was a project in the middle of COVID. And I just stepped into the world just with the purpose of serving people, not with that, like you said, not with like the goal of selling. I was not even thinking about sales back then. It was just all about creativity. My brand became a creative outlet and a way just to connect with others and teach others and make it fun. And so that visibility fear can be really debilitating because it's like you have your post ready and it's like, when am I going to put it? Because no, I don't want to do it right now. Like, I don't want to do it later. Like, oh, it's been a month and I haven't put it. Like, it's that visibility fear. How do you tackle that? It's just by taking the step. Like, there's no other way. You just, again, it just start messy, start simple, get fancy later. The Brain PT, how it is now, it's nowhere close to how it started. Like, if you see my logo, my videos back then, just my kind of showing up to the world is completely different to how I do it right now. And so that's one thing. The second one is consistency. I see once you establish your personal brand, one thing that, going back to that example of Alex Hormozy, he stays consistent with the value he offers for free. So he offers so much value to people that is so helpful, but it's consistent value through his podcast, through his social media. So it's all consistent. And consistency is what people don't understand because there's a difference between consistency and frequency. So back then, with the Brain PT 2020, every single Friday, I was committed to post an Instagram video. And every single Friday, I wouldn't post 5 times a week, 7 million times a day, or what I call bro marketers sometimes tell you to do. You just need to pick a day and commit to it. And that's it. That's consistency. Consistency. You show up no matter what. You show up even if it's the smallest post, but of course it has to be valuable, to like the most epic reel that you want to create. So it just has to be consistent. If you pick 2 days, you have to serve and nurture that audience. Serve them with all you have. Serve your corner with all you have, but being consistent. Because let me tell you something, when people start liking what you're putting out there, they will start anticipating it and expecting it. And if you don't deliver, there's going to be a little disappointment. And I'll tell you this because that's what happens to me and the people I follow. When they don't post their weekly podcast, I'm like, now I have to wait another week. So that's what happens when you're building your personal brand and nurturing your audience and bringing value. And people confuse frequency with consistency. And so I think those are the two things. I guess the last thing would be they try to make the perfect graphic, the perfect reel, the perfect thing. Again, sometimes my best performing content, it's something that literally pops up to my mind and I just do like a little post and put it out there and it does so good. And then the content that I take forever, I do a Canva post, all like nice and pretty. It's like, doesn't do good. So just ship it. Like Seth Godin says, just ship it. Just put it out there. And then your people would start telling you what they like. You start like data, right? You start receiving data. If you put a post out there and doesn't do good, that is because your audience is expecting something else. Let's tweak it. So those are the 3 things. So it's the visibility fear, how you tackle it. You just need to post. You need to just put yourself out there, put the intro post. Second, consistency is different than frequency. And the third is do not post a perfect post. Nobody likes perfect. People like to know that people are imperfect, just like us, right? And so messy, imperfect action. Get fancy later, get better later is how my mentors have taught me. And it's been such a difference. It's made such a difference in how I manage my business and my brand.
That's fantastic. Yeah, no, that's fantastic. And just watching you on social media, it's just so natural. It just feels natural. And I know that's taken time. And I looked up one of the quotes from Stephen Bartlett from the Diary of a CEO, and it says, growth happens when you start doing the things you're not qualified to do.
Yes.
And I'll say it twice because it's that good. Growth happens when you start doing the things you're not qualified to do. And boy, have I felt that. And especially as women, especially as Latina women, I live with a disability as well. The imposter syndrome is such a real thing. Anne Hathaway talks about it to, Fortune 500 CEOs and owners. And I think that once you have that network of people who you can reach out to and reach out for support and just even get some feedback, and also then exactly just like data, mining is like what has gone well on the internet. Use that information. And I think it's important to connect to. And I think if we're in, safe spaces in terms of putting really good information out there that is trying to, change the world in some capacity or another, it's been really cool to see your journey. So, just thank you so much for sharing what you do.
Yes, of course. Yeah, it's been such a fun little discovery that I've made.
Exactly. I think also, especially when we are bogged down for the people that you are speaking with, and likewise here, for the academy side of things, when people join our programming, 95% of our folks say that we've dosed the programming just right. And that's someone who's sticking to a 12-week program. So the initiation of being nervous to start a 12-week program. But then again, when they finish, 95% of folks saying we dosed this just right. And we've had athletic trainers come through that are like in March Madness. We've had 5 women give birth to babies through Concussion Corner programming. So again, we're here for the working healthcare professional, and so are you. So what are the programs that you're offering that are coming up? How often do you offer them? And the time is now. So please tell us more about what's coming down the pipe for you before we head out.
Yeah, so on the fall season, it's usually when people start thinking about that specialty exam that I mentioned at the beginning. And so that's typically the season where my focus shifts to serving that group of people. And so I start putting a lot of podcast episodes and content, free resources, all related to help them through their preparation phase. And the beautiful thing with that phase, and I think it's the best part of it, is that again, they connect with me. And so secretly I become their little like secret cheerleader through the process. And so I've built so many friendships through this process. And I think that's something that no other program can offer, because I'm truly committed to that preparation with you. And so I feel like I've built those friendships. I can shout out to Noreen, shout out to Sam and Meredith. So they've been my friends since the prep, and Nick and Beto, Alberto Barrera from Neurostrength Network. And so I've built these friendships through that process. And between those resources, I do offer a course that it's evolving right now. So it was called Neuroanatomy Simplified, which I think if you truly know neuroanatomy, you can unlock so many questions in that exam, because they will present you with a case, they will present you with a patient presentation, and then they present you a case with a lesion location, and then you have to figure out how they're presenting, right? And so if you know neuroanatomy, you can unlock so many questions I've figured when I was studying. And so that one is shifting a little bit. I'm debating if it stays like a workshop by itself, or if I'm going to turn it into something different, combine neuroanatomy and something else. So we'll see what comes out, but that one is usually taking place around November. So the Neuroanatomy Simplified, it's a low ticket offer workshop. So that one, you just go to my Instagram at @the_brain_PT or thebrainpt.com just to learn about Neuroanatomy Simplified. That's the best place to start the prep, just to ignite that process. And then that between the winter, I do offer free resources also for the NCS prep folks, webinars that are free. I have a Parkinson's Plus or Parkinsonism, atypical Parkinson's. The language has changed, but that one is a free webinar. It's a very good one. And then that is just fall and winter. And then in the summer or spring and summer, I start just tweaking and kind of like going into that dimension of personal branding. And it's all about personal branding. I offer this really popular one, a boot camp that, again, it came out of nowhere and it turned out to be super popular and so good for building your personal brand as a neurotherapist. It's called the Building Your Neurobrand Bootcamp. It is usually in the summer. And the other and last course that I have right now is if you are wanting or thinking about starting or launching your first paid workshop course or paid masterclass It's a different process than in person. So I offer what's called the From Neuroclinician to Neuropreneur course. It's a 6-week course, high touch. You get access to me, feedback to me. We have live brainstorming sessions, live sessions of training. There's AI tools that you can use that I've built for you to help you with the course creation process. It's so good. It's so much goodness inside that course. Right now, we are on week 3 of validating your course idea with your audiences. So it's been such a good journey. So those are the 3 things: neuroanatomy simplified, tweaking, evolving, not yet sure what's going to turn into, and then building your personal brand bootcamp in the summer, and the From Neuroclinician to Neuropreneur. All of this you can find thebrainpt.com. You can find the courses right there at the main page, or follow me on Insta at _brain_PT to find all about it.
Amazing. We're going to put all those links in the podcast show notes. And then where were you 4 years ago when I needed you, when we were building this Concussion Corner Academy? Let me tell you. So I'm so glad that you're here, you're out there. Again, I think it's just so necessary to have these conversations, and also because you've gone through the process yourself.
Right.
So
right.
see one, do one, teach one. We do it in medicine, and we also do it in this aspect as well. So my mentors like Karen Litzy and Tracy Scher and, PT for Women, like they've all come together and kind of put me under their wing. And these are all in totally different aspects of my world, right? So from pelvic physical therapy to Healthy, Wealthy, Smart with Karen Litzy, who's like the OG PT podcaster. Yeah, she helped me start the podcast. And, I'm just so forever indebted to her. So do check her out as well at Healthy, Wealthy, Smart. But, to leave our listeners with, some inspiration of, why they need to connect with a personal brand and I'm going to say this intentionally, as just a healthcare professional, especially when so much has been lost with third-party payers, or being lost in the system of just healthcare, just nonsense that we're kind of used to, that we don't really, unless we own our own practice. For someone who may feel lost and wants to get this information out and wants to reignite, or maybe be feeling burnt out and want to teach in a different way that's not like just traditionally through a university style, what's some advice that you can impart as we head out now?
Yeah. So for healthcare providers, I think a personal brand is a powerful asset in their career. It's not just a buzzword, as people might think. It's a brilliant move for your career. Why? Because your people right now, lurking is the new networking. Patients, other providers, other community members, where are they looking now? It's on social media, right? And yes, personal branding is built through social media, but like sometimes if I'm looking for a service, I'm looking to see if they have an Instagram, what are their reviews, what are people saying about them, what are the type of things that they're putting out there, the value. It's literally, the personal brand is your digital resume. Your personal brand will speak about you in ways that your resume will never, ever will. And it is always yours. And so you need to remember that social media now, it is a new search engine. We start looking for symptoms of things. Guess where? On social media now. And so people need to be aware of this, that building a personal brand, it's where we need to shift our focus, because if we want to serve patients, whether we want to start a business, brick and mortar business, mobile therapy business, if people know you and know the value you can provide, know how you're serving your people, they most likely will pick you. And also, if they connect with you, you can be sure that they will look for you versus someone else who doesn't have a personal brand. So social media is the new search engine. We use primarily social media platforms for online searches. So as a healthcare provider, especially we want to build a business, if we have education business, brick and mortar business, your focus should be personal brand. Because if people trust you, if people like you, if people know you, they most likely will become your client, your patient, your customer. So I think that is the value of a personal brand in this digital world where there is so much distrust. There's so much distrust. There's so much AI. There's so much automated messages. There's so many bots. But your personal brand is you. It's what makes you human, right? In a mistrusted world. And so I feel that is the thing that AI will never That is the hole that AI will never fill. And that is you and your personal brand. And so that's what I feel it's the biggest thing right now in this digital world.
Fantastic. And I think we're on the same social media watching platforms as well. And I think for people to connect to, they're doing research. YouTube is the number 2 most searched platform in the world. And I think we're seeing TikTok and Instagram coming up. But the algorithm for TikTok and YouTube in particular being connected directly to Google is huge. So if you're wanting to get your information out, I think it's important to connect to a platform that may be relevant to your niche. Additionally, I love watching Chris Do. He's the future. If you haven't, he's the future without an E at the end. So FUTUR. And Christo you're on his platform as well. And, he talks about, how social media presence builds trust through value. Your audience knows what to expect and continues to engage. And then when you deliver regularly, like that was your Friday post, people stay for your growth and they're invested in you, not just the content. So again, it's been so lovely to learn from you, spend time with you, share space with you. And again, we'll put all of the places to connect with thebrainpt.com and the brain_pt Instagram. And Congratulations on crossing 10,000 followers, almost coming up on 11. So, congratulations on that. It's a pleasure to see you grow. And thank you so much for coming on. And we'll put the link to our crossover podcast as well in the show notes as well.
Yes, it's been such a pleasure. Yes. Have a good day.
Take care.
Bye.
Thank you for joining us for this conversation with Dr. Lily Jimenez. Together, we explored common myths in concussion care, outdated practices to retire, the value of interdisciplinary approaches, and how personal branding helps clinicians connect with patients and colleagues on a deeper level. Dr. Jimenez has the NCS Kickstarter Bootcamp for November of 2025, and PTs who want to build their personal brand and launch their first online course will reopen at the beginning of 2026. You can learn more about Dr. Jimenez's work at thebrainpt.com and follow her on her Instagram at the_brain_pt. If this episode resonated with you, please subscribe, rate, and share Concussion Corner Podcast with your colleagues. And remember, enrollment is now open for Concussion Corner Academy. Join us by October 4th to have live access to our full fall calendar of live faculty sessions and connect with our international community of healthcare professionals. Visit us at concussioncorner.org to claim your seat. Thank you for stopping by our Teach One, Serve Many community. Take care.
Thank you for listening to the Concussion Corner, hosted by Dr. Jessica Schwartz. The information in this podcast is for entertainment purposes only and not to be used as personal medical advice. Don't forget to follow us on social media on Facebook, Instagram, Twitter, and YouTube at Concussion Corner.